This is a contrast CT scan of a 24 years old female patient. She is a known case of imperforate hymen. Her vaginal opening was absent. She was initially diagnosed in 2013. Her first surgery was done. Her second surgery was done in 2021. On second surgery, she had hematometrocolpos. Her proximal vagina was hugely distended. Now, her third surgery was done about 2 weeks ago. She had hematometrocolpos. She presented with septicemia, and there was a large endometriotic cyst on right side because of the spillover of the endometrium into the peritoneum. Now, partial hysterectomy was done. Right oophorectomy was also done. Now, patient has presented with fever and pus discharge through the vagina. Repeated reparative surgeries of vagina were carried out, but unfortunately they all ended up in failure. And now presently she had a linear streak-like vagina, and there is a history of pus discharge. She has presented with high-grade fever with rigors. Now please observe that small intestinal segments, they are prominent. Maximum small gut diameter is approximately 2.7 centimeters. No obvious signs of intestinal obstruction. Orally administered contrast medium is passing through the jejunum and ileum. Now please observe this thick walled small gut segment here. Its gut wall thickness was approximately 8.6 millimeters. This is suggestive of inflammation. Now this is a gram-negative abscess, a cystic lesion in the upper part of pelvis containing air lucencies, thin enhancing walls, density of adjacent fat is increased. Now there is another abscess as well, this one here, along the lateral surface of the ascending colon. This, please observe the enhancing walls. Now I come back down to this gram-negative abscess here, this one. Now this is the residual uterus. It has thick walls, air is present inside it, and airflow level is present. And please observe the enhancing endometrium suggestive of inflammation and endometritis. As I scroll it down, this is the thin streak of air inside the reconstructed vagina, this one here. Now I will show you her sagittal scan. Now please observe, this is the gram-negative abscess, this one, containing fluid and air lucencies, thin marginal enhancement. Now this is the residual part of the uterus. Now this is communicating with the uterine cavity through this small opening here. This one is the site of communication between this abscess and through the fundus of residual uterus into the uterine cavity. This is the airflow level in the posterior dependent part. So pus is coming from this abscess down into the residual uterine cavity, and then down into the, now this is the communication downwards with the, this is the streak-like vagina, this one. Air lucencies are present inside it. And so pus discharge presently with which the patient has presented, in fact, is coming from this abscess down into the uterine cavity and then downwards through the rudimentary, rather deformed, reconstructed vagina. Another abscess is also present in the lower part of anterior abdominal wall, this one here. Air lucencies are also present inside it. This one is the abscess here. Patient has mild ascites. Now I go back again. Again axial scan. No ovary is present on right side. Left ovary, this is the left ovary, this one is the left ovary. Now this is the delayed scan. Superior wall of urinary bladder is thickened, however, there is no communication of the urinary bladder with either the abscess or the uterine cavity. This is the delayed sagittal scan. This one is the abscess cavity here. Please observe the thickened wall of urinary bladder superiorly, suggestive of inflammation and its adherence. Uterine cavity. This is the site of communication through the residual fundus. This one here, a thin streak like this one. Air fluid level, and this is the vaginal streak extending downwards. All abscess here. This is the left ovary. This one is the residual left ovary.